Hello, I'm Mitch Hagins, General Manager for Studer Group Canada. Welcome to this brief vignette where I'll be discussing an article that we'll publish in Healthcare Management Forum this spring. The article is entitled "The Power of Engagement: Creating the Culture That Gets Your Staff Aligned and Invested." I'm very pleased you could join me for this brief review of that article. I'd like to start my conversation with you with an attribution. And the attribution is to the 5 organizations and their leadership teams that are cited in this particular article. Royal Victoria Regional Healthcare Centre in Barrie, Ontario, Arnprior Regional Health in Arnprior, the Ottawa Hospital in Ottawa, Sault Area Hospital in Sault Ste. Marie, and St. Joseph's Healthcare London in London, Ontario. Thanks to each of these organizations for the work and rigor as they address what we believe is a critical issue and opportunity in healthcare today, and that is the matter of employee engagement. Employee engagement is the issue of our time. And much like a movie trailer or an advertisement on television, we are wanting to capture your attention. And why? Because employee engagement is fundamental to organizational achievement, to organizational culture, and ultimately to the quality of care delivered to those in our care. And so let me explain the article from a framework that we use routinely in our partner organizations, and that framework is why, what, and how. So why is engagement important? Well, in each of these organizations and in your organization, you have what we call mission. That is what you want to achieve. You have vision, that is your aspirational goal. You have values, and that is the way you behave, and you have a strategic plan, and that is your roadmap to accomplish those things. Engagement drives mission, vision, values, and strategic plan, because part of engagement is not only workplace presence, being where I need to be, workplace contribution, using what I know to help the organization, but the key factor in engagement is I believe in the belief structure of the organization. So if I'm at St. Joseph's in London, we're talking about complete confidence. If I'm at Royal Victoria, they're talking about my care. If I'm at Arnprior, we're talking about exemplary care. If I'm at Sault Area Hospital, they're talking about eye care. And if I'm at the Ottawa Hospital, they're talking about care like a loved one, like we want loved ones to receive. Those are missions, and engagement links to mission and thus drives it and fulfills it. And we understand that mission and vision and values and belief structures are fundamental to securing actions, practices, techniques that assure quality and safe care. So that's a bit about the why engagement is important, and we cite that in the article. The second factor for engagement is the what, and those are measures and metrics. There is a measure called employee engagement, a physician engagement measure, but there are also attending measures like sick time utilization, workplace injuries, other measures that indicate an alignment and investment by staff and physicians in the success of the organization. So while engagement is a key factor in sustaining mission and living values, it's also fundamentally measured in outcomes of the organization. So that's a brief bit about the what. You'll see demonstration in the article of some of the achievements of each of these 5 organizations, demonstrable results across a spectrum of metrics and measures, all we believe driven by employee and physician engagement and alignment. The final factor then is how. And in the article, we reference a framework, an execution and accountability framework that we refer to as evidence-based leadership. And all that means is let's align the goals of the organization. So while we talk about mission and vision and values and strategic plan, what are those measures of those things? That's aligning our goals. And once we have aligned goals, then we can do a diagnostic, if you will, and understand what should be the aligned behaviors. What are the few behaviors that evidence indicates will drive the broadest results? And by choosing selectively behaviors, we create bandwidth. Bandwidth for staff and bandwidth for leaders to do what we really want to do, and that is transform delivery of care. So while we talk about access and we talk about quality and we talk about stewardship and funding, ultimately we have to talk about transformation, but we have to create capacity to do that. So fine organizations like Sioux Area Hospital, a leader in lean strategies, can create bandwidth by selectively choosing behaviors their leaders are involved in to drive those aligned goals. We hope that you find the article helpful in your organization because, again, you have mission, vision, and values, and engagement of staff and physicians is fundamental to achieving those. We hope you'll see value in the discussion of the whats or the outcomes from these 5 organizations because they are striking and they are being sustained, all because of the alignment and achieved through engagement. And finally, we hope you'll see value and purpose in the methodology of evidence-based leadership and some of the tactics that these organizations have chosen to use to drive engagement. By learning from another, we can replicate best practice, migrate best practice, if you will, broadly and quickly so that each organization that's viewing this short vignette will achieve sustainable results, especially related to quality and safe care. So thank you for joining me for this vignette. Thank you in advance for reading the article. We think it's a grand representation of 5 organizations, the work that they've done, and we're very proud of them. Do have a great day. Cheers.